Thank you and welcome to the show this morning. The topic this morning is minority transplantation organ donation program. And we're fortunate to have with us to talk about organ donations and transplantation two persons from Meharry Medical College. First is Dr. Makita Faulkner. Dr. Faulkner is at Meharry Medical College, and with Dr. Faulkner is Dr. RStevenson. Dr. Stevenson is a transplant surgeon at Meharry Medical College. As a matter of fact, he is the chief transplantation surgeon at Meharry Medical College. And Dr. Faulkner, let me welcome you and Dr. Stevenson to the show this morning.
Thank you very much.
You know, Dr. Faulkner, I think that what we'd like to do this morning is to talk about minority organ donations and tissue transplantations and other issues dealing with the problems that minorities have in terms of organs and tissue donations. But before we do that, let's have you and Dr. Stevenson give us some information about your background, your education, and some of the things that were important in your lives and leading you to where you are now.
Okay. Well, first of all, I am a graduate of Meharry Medical College. I graduated from Meharry in 1981 and decided to go into internal medicine, so I did my residency there from 1981 to 1984. And from there I did public health in Mississippi. After being in public health for a while, I decided to go into kidney diseases, so I did a fellowship in New York at Long Island Jewish Medical Center and returned to Meharry in 1989. When I got back to Meharry, we started our kidney program, our dialysis program there, and we had quite a big kidney service there. And at that time, I noticed there were a lot of patients going on to dialysis, a lot of minority patients. Even though this state is only 15% minority, we end up about 50% on the dialysis waiting list. So a lot of us are in the end-stage renal disease program. Then I met Dr. Callender, who is a transplant surgeon at Howard University, and he gave a program in St. Louis that talked about organ donation and the need for organ donation among minorities. At that time, I said that if there was anything that I could do in that area, that I would be willing to put full forth effort to try to get more African Americans off of dialysis and to encourage transplantation. And after that, I worked at Meharry for about 3 years on very small grants that dealt with organ donation. We had a community program, then we had a national health professional program for students at HBCUs, which was quite successful. But later, after Meharry decided to move over to the General Hospital for renovations of the hospital, I decided not to apply for a grant at that time. But Howard, Dr. Callender at that time at Howard University, had received a national grant to set up local minority organ transplantation education programs in cities across the United States. And Meharry received one of those awards from Howard University. And therefore, we've been working now with the MOTEP program, which is the Minority Organ Tissue Transplantation Education Program. And now we're starting this year, we're going full force, and hopefully we can work with the Kidney Foundation, the NAACP, and Tennessee Donor Services, as well as the Leukemic Society, which deals with bone marrow transplantation. And hopefully we can get enough people to donate for minorities to donate for bone marrows, so we can get some people who need bone marrow transplantations who are minorities off the list as well.
Very good. Dr. Stevenson, I think that she's talked about quite a bit of activity in the area of minority donations, but now organ donations. But now when it comes to organ donations, and I think as your green scrub suit would indicate, when it comes to organ donations, as the chief transplantation surgeon at Meharry, what do you see and how do you see this as an issue? But first, give us some information about how you became the chief transplantation surgeon at Meharry Medical College.
Yes, sir. Well, I'm from New Orleans originally. I went to Meharry Medical College also. Upon graduating from Meharry, I did a residency in general surgery at Howard University Hospital in Washington, D.C., where I trained under Dr. Clive Callender, who Dr. Faulkner spoke of. Dr. Callender is also a graduate of Meharry, and while at Howard, I worked with him on the transplant service, and really became interested in it then, and told him at that time when I was a resident that I would like to go back to Meharry to do at Meharry what he's doing at Howard. I went on from Howard to the University of Pittsburgh, which is the largest transplant center in the world, and trained under Dr. Thomas Starzl, who's a transplant pioneer. And while doing my training in multi-organ transplantation, I began to do a lot of speaking in the black community on the issue of organ donation and transplantation. Decided to come back to Meharry and returned to Meharry in 1992. Was it 92? No, 1994. 1994 when I came back, and had the pleasure of working with Dr. Faulkner, who's been doing excellent work in the organ donation aspects, and so I think that I just wanted to be with her doing these projects, and the team of the nephrologist and the transplant surgeon working together, I think has been going well and is going to blossom. That issue is very important. As Dr. Faulkner said, we make up half of the waiting list for organs, and one of the things that we haven't been doing as African Americans is donating organs in the same at the same level. So I want to help further that, just as Dr. Faulkner wants to help further
Dr. Faulkner, I think up front, when you talk about the donation of organs, what do you find to be the major obstacle to that happening in the African American community, just as a question up front here?
Well, the major obstacles that have been found nationally as well as locally, and we did some community work and with questionnaires to the local community, is that there's mistrust of the medical community. The patients just feel that, or the community feels that someone will take their organs without them actually being brain dead. And so they don't trust doctors when they come into the emergency rooms and say, well, you know, your family member's brain dead, would you like to donate? They don't think that they have enough information at that time. So mistrust is one of the medical community. Number two is that they think there may be some disfigurement of the bodies when when the funeral comes around, and they ask morticians and other people in the community, should they donate? How would things be with the burial? And some people don't know, and so they'll say, well, no, I wouldn't do that. So they figure disfigurement will be, one thing. Then another thing is that they feel that the organ should go to another black person. They think that if the organ is taken, or they give the organs, that they'll go to a white person. So there's some racism involved in organ donation as well. And Dr. Stevenson can elaborate on others because he's in that area as well.
Very good. Dr. Stevenson, we'll have a break coming up and we'll interrupt you, but go on and give us some information.
Yes, sir. Well, one of the main reasons is lack of education about the issue. All the reasons that Dr. Faulkner has elaborated on so far are very important, and one of the things that I think is also very important is that there is the lack of education about the issue. So that's why Dr. Faulkner, myself, Dr. Callender, his group, we want to make this thing a national effort to try to increase the awareness about organ donation in the African American community.
And how do you find that that African American donations compare with others, Dr. Faulkner?
African American donations are low. We were 3.5% about 10 years ago, 10, 15 years ago, when Dr. Callender was first approached about the low organ donation rate of minorities. Now we're up to 12, 13%, which is still low because we're about 33% of the dialysis population overall. And we are still about over 50% of the transplant waiting list in many areas. So still that donation is very low, and we're trying to get it up to a higher number so we can get more of us off of dialysis.
Very good. And when we come back, Dr. Stevenson, we're going to have you to talk about some of the problems associated with that. We'll be back with you following this commercial break.